Okay, so today we're going to be doing an assessment on a preeclamptic patient. So today the sloth is going to be our patient again. So when you're determining if the patient has preeclampsia or not, there's some things to keep an eye out for. So the first thing you're going to do is you're going to obviously assess their vital signs. So some vital signs, abnormalities for hypertension or for preeclampsia is you're going to have hypertension. That's the uh, main thing that determines whether you have preeclampsia or not. There can also be signs of lower back pain due to liver impairment, blurred vision, sudden weight gain, protein in the urine, and shortness of breath. So, in order to diagnose preeclampsia, you have to, um, the patient has to have hypertension along with at least one other symptom in the previous symptoms I listed before after 20 weeks gestation. So, if the mom has hypertension before 20 weeks gestation, or if she's always had hypertension, if she has hypertension after 20 weeks, it doesn't necessarily mean that she does have preeclampsia. So that's an important indicator, is it's after 20 weeks gestation, because preeclampsia develops during your pregnancy. Some medications we can give our patient is nifedipine, which is a antihypertensive drug, and it's going to help lower the mom's blood pressure to a normal range, because that's super important, and we're gonna have the mom continue to monitor her blood pressure several times a day, and hopefully can get into the normal range of 120 over 80. But if it gets above 140 over, let's say, 90, then we would have to report back to the doctor. Another medication that will help during preeclampsia is magnesium sulfate. So when you're preeclamptic, you're more prone to having seizures. So what magnesium sulfate does is it's the number one go-to medication for seizure prevention and control. Um, and then we have what's called HELP syndrome, HELLP, and that's when you have a lot of the symptoms, hemolysis, elevated liver enzymes, low platelet count, and when that occurs, unfortunately, we have to induce labor for the baby, even if it's early, because with preeclampsia, if you develop the HELP syndrome while you're preeclamptic, it can cause intrauterine growth restriction, and then it can also cause severe respiratory distress for the fetus, or even having a hemorrhage. So we just want to make sure that we carefully monitor the baby, and also, to repeat, it's very important to where if the mother is far enough along to, even without the HELP syndrome, she's, let's say, 8, 9 months pregnant, we want to probably do an induced labor, because that's the only way to get rid of preeclampsia, because if we wait, the baby can develop those side effects of the HELP syndrome, along with developing hypertension, and we don't want the mom to continue to have hypertension after birth.